Well, joining us in the studio to tell us a little more about the new malaria vaccine and fighting the spread of infection is Meyer from the Bernhard Nocht Institute for Tropical Medicine in Hamburg. Thank you very much for joining us, Mr. Meyer. Now, as we've just seen in that report, the vaccine that is being used on children is only effective in half of them who receive it. Why is that?
Indeed, it's less than half. It's in very young children and infants. It's 27%. In preventing clinical malaria cases, we do not know anything about mortality rates using this vaccine. This vaccine is not really very far developed. On the other hand, it's the best what we have at the moment. I'm very sure that the company which has developed this vaccine will try to develop it further. And we will see what is coming out. But the vaccine, in fact, with an effectivity of, let's say, around 30%, is not good enough.
So we don't really have any concrete answer, do we, as to why it's not necessarily working? But let's look at why it's taken this long to come up with an actual vaccine.
Because the infectious agent, Plasmodium, which causes malaria, is a very complex organism with many proteins. And the more complex an infectious agent is, the more difficult is it to develop a vaccine or a substance which later on will provide immunity. So in viral diseases, it's not simple, definitely not. We all know that we do not have a vaccine against the HIV virus. But viruses are not that complex as the malaria infectious agent is.
Malaria with climate change is moving north. Do you think that this has something to do with the sudden surge of interest in developing a vaccine all of a sudden?
No, malaria is one of the big three diseases, HIV, tuberculosis, and malaria. And given the number of children dying in Africa every year from malaria, which is around 700,000, 800,000. Nobody is very sure about that. So there's an urgent need to develop a vaccine against malaria. It's one of the big killers.
That's one of the things they're doing. What else are they doing to fight this disease right now?
There are other measures, control measures, like mosquito nets, impregnated mosquito nets, which means that the mosquitoes are impregnated with the substance killing the mosquitoes. Then correct treatment of malaria, really good patient compliance, correct treatment cycles, and so on. There are quite a lot of measures which can control or which can help to control malaria. And in fact, the number of cases has decreased in the last years. We have 10 years ago, we had 500,000, 600,000 clinical cases per year, and this indeed has decreased.
But yet the medicine is becoming less effective. So, I mean, you know, what about the medicines that we're using to treat them at the moment?
At the moment, we can treat malaria, but what you mentioned, resistances against the substances currently in use is developing, and there is also an urgent need to develop new treatment measures.
Meyer, thank you very much for joining us here at Tomorrow Today.
Okay, welcome.